Hello everybody, today I am going to talk about this article, Reach of Osteoporotic Fractures in Age Adult. This article was approved in June of 2016. We recognize a metabolic disease because there is a loss of resistance. These cause fractures occur that affect our health of patients. Fractures are a multifunctional outcome with components intervene that, together with age, influence bone architecture, body mass index, and resistance. Some factors that may intervene are history of fractures, genetic, drug state, and bad habits such as alcohol and tobacco use. These factors can be related increase of risk of FOS such as functional or visual impairment. The International Osteoporotic Foundation can use that 1 of 3 women or 1 of 5 men suffer of fracture or osteoporotic fracture.
Protocol for a randomized controlled trial of standard 1 management versus negative pressure monotherapy in a treatment of adult patients with an open fracture of lower limb. UK 1 management or open lower limb fractures was accepted on July 20, 2015. Joel Aitchison, Nick Parsons, Lucy Bruce, Star Petrie, Elizabeth Tutton, Kitty Willett, and Sarah Button. Patients who sustain open lower limb fractures have reported infection risk as high 27%. The type of dressing applied after initial debridement could potentially affect this risk. In this trial, strand dressing will be compared with a new emerging treatment, the negative pressure wound therapy for patients with open lower limb fractures.
Management of lower extremity fractures in the elderly, a focus on post-operative rehabilitation.
It's currently estimated that 901 million people worldwide are over the age of 60, representing 12% of the global population. The number is expected to reach 1.4 billion by 2030 and 2.1 billion by 2050. Due to increased life expectancy, osteoporosis poses a recent public health challenge. Osteoporosis develops as a consequence of age-related resorption of calcium from bone, which result in a reduction in bone mass and strength, directly affecting the mechanical properties of the skeleton. As such, elderly patients with osteoporosis are at increased risk of fracture. Aging and the inevitable resumed physiology changes are complex and vary by individual.
Introduction. Warning increased incidence of hip fracture in adults over 60 years of age. Pathologic, economic, and social burden being changed for public health. This study seeks to assess patient degree of satisfaction with health care service and assess outcomes, material and methods. Exploratory observation described cross-sectional study with telephone surveying in patients 65 years old, 1 year old, it fracture surgeon intervention in Medellín, Hospital Universitario Mayor, Bogotá. Results of 287 patients, 160 met the inclusion-exclusion criteria and accept to participate age rate weight 65 and 90 years.
Hello, are stress fractures in the young adult height. Actors Christopher James Lowndes, Shipchat Hamer Salah, Heisa Youssef. Year realization April 2020. Astral. Stress fractures is caused by repeat suboptimal loading on a bone, overeating, and offset to single severe impact. They occur when the stress on bone exceeds the capacity of the bone to withstand and heal from the recurrent stress. This can occur in highly committed athletes and impatients participating in sport or activities involving repetitive weight-bearing activity. Stress fractures have a predicament for certain bone location, with most occurring in the lower extremities.
Hello. Introduction. Fractures of the distal femur, whether supine colon or intercolon, have hysterocalcity, with difficult to decrease during the tour, is user natural and drift of community. The proximity of these fractures to the queen joint fructis hinders the full ranges, the shift, and the improvisation of surgical implants. The treatment of distal femur fractures range of changes.
Development of a prototype to support the lower limb during the anticipates of open fracture. Introduction. A population growth and increased power of the means of transport have led to greater incidence of pain while open fracture, increasing bed occurrence rate and the risk of bone infection in hospital setting. Social infection rate to orthopedic producers are safe and catastrophic complication for both pain and surgery in hospital. The infection increase the cost of hospital stay and the lack of stay, the person fighting for their work and family life.